係請 free sitting 啦。咁因為我哋大家都好熱切期待咧，聽余教授講呢一個中醫呢、個擊抗新冠病，因為呢樣嘢我唔識嘅。咁好多朋友大家都知道新冠改寫咗兒科，咁而好熱切咁，大家而家面對緊差唔多係第6波嘅疫情。我自己都睇咗50個以上嘅新冠細路仔嘅，咁而越睇得多嘅時候，先至發覺好多嘢唔識，因為兒童同大人係唔係好一樣，咁而家仲有中醫咁政府俾我哋嗰個保健包咧都有呢個蓮花清瘟膠囊，我都唔識。咁我就係啱啱4日前有個阿媽，佢話我成家嘢咗女而家係6歲，請問可唔可以食呢樣？因為你都冇西藥嘅特效藥啱女。咁呢個我話你最好問問中醫先，佢要望聞問切睇咗病人嘅情況。咁我哋一諗起中藥其實喺新冠呢個大爆發嘅時候咧，對兒童嚟講，可能個作用咧係都好重要，尤其是我哋好多西藥咧係唔適宜喺啲輕症或者我哋常見發高燒頭痛嘔吐思考症嗰啲，咁佢哋好多都唔係好啱用。咁有冇橋咧？咁我哋可唔可以用中藥咧？咁我哋council 即刻就諗起當時得令，因為我哋有位兒科醫生係中醫又係西醫又係，佢係 fully 註冊有牌嘅。咁我哋今晚咧有余秋良教授咧，咁佢個 CV 太長，我亦都唔嘥大家時間，大家都希望聽佢嗰個戲肉，即係多啲我哋係 food for thought，希望啟發我哋將來係點樣去醫治下一個新冠嘅兒童病人。咁余教授就係我老師嚟嘅，咁同埋佢亦都係第一個兒科，佢係去攞咗中藥嗰個牌。而家佢係一個名譽教授喺呢一個香港浸會大學，咁係呢個中醫藥嘅學系。咁而家亦都係 Director of Intermed Hong Kong， 咁同埋喺香港中文大學呢個亦都係Professor in Chinese Interventional Medicine。咁就係亦都我哋係好開心，係我哋香港兒科醫學院基金嘅副主席。咁我唔想嘥大家時間，大家都好熱切期待聽余教授嘅演講，咁我就將個場地交翻俾余秋良教授，請各位歡迎。
好感謝張醫生俾我哋一個好好嘅開始。今日咧我好有機會講呢個中醫擊抗新冠疫情咧，咁我就曾經咧都考慮好耐問題。So I finally decided to talk in English. The reason I talk in English is twofold. First of all, it's more scientific. Not really, but more importantly, it hopefully could be the talk may be listened by the profession outside this room. Okay, so I think talking in English is much more difficult, and I will try to talk in Chinese whatever whenever I need it. Okay, but I think this is useful to talk in English for my polishing myself. So bear with me. First of all, I'd like to introduce a bit on myself because I know that Dr. Chau has told what I am. But just to understand that I started in pediatrics, and I thought when I was so very young, being young and having more naive dreams, I thought not doing pediatrics is helping a child, and the whole person, when they grow up, would become different. So this has never changed my mind so far. And I was in pediatrics, and I was lucky enough to follow Hutchison. And I would say his emphasis in general pediatrics has hung on me all my life. So although I've been working with, first of all, renal medicine after Dr. Chau, who is the eminent renal nephrologist here, and having been able to do plasmapheresis and hemofiltration and hemodialysis in the first instance in Hong Kong, and that has actually, I think, been what Wong Setlin has excelled myself even, but I still grow in general pediatrics. And that's why I changed into general practitioner. In fact, the more years passed, people ask what specialty I am. I probably left more of my specialty into something more general. But being in Chinese medicine, I have learned more from patients, being young and old, and even proteinuria can be remitted without I need previous know of it. And rising creatinine actually can be reverted. These are some of the people who are in my teachers, and this was the one who wrote the Zhong Chou, right, in Hong Kong. He just died a week ago, and this was one in leading in Hong Kong Chinese University of Hong Kong School of Chinese Medicine. So I was lucky enough with the grandmaster in Chinese medicine. And at that time, when I left the university, I started in renal clinics. I think I can use not this one. Forgive me. Right? Nobody is in front of me anyway. So I think this is even clearer. So I started in Chinese and Western medicine and open clinics. At that time, the Chinese medicine has a lot of obstacles and hurdles, and so whatever I do was actually a lot of difficulties. But at least I did something, and in that time that we finally started a group, and later turned into the what we call the Hong Kong 香港中西醫結合醫學會. And here, you know that this is Chen Ke, who is now the grand master in Chinese integrated medicine in China. He led many projects, not only private, government projects too. And these are the mentees I am with me, and you probably know about this mentee who has won both distinctions in Chinese medicine and Western medicine. And this is probably Karen, you know too. He is working in ICU, and this is the master I followed. And this picture, I hope that Professor Leung, who is another teacher of mine, and Leung, is inside. That also Louis' name too, right? Okay, it hang over my office, so I have it always been with them. What I'm trying to say is that after all this, you know that I become very non-specialized. So being very non-specialized, I'm talking something today not for my specialist field, right? This is a disclaimer. So in the COVID times, I was lucky enough to help in certain joint ventures in which they to put my name in. It's called Hong Kong Alliance of Integrative Medicine Against COVID, and I was able to at one time led a course in COVID by the Hong Kong BU Baptist Heart University, and that's why I am now bold enough, right, having courage enough to talk a bit more. And hopefully, what I'm trying to say so far is to convince you that whatever I talk, being non-specialized, hopefully can help. This is the introduction. So going back to the COVID is simple. that this is the early days when you can see COVID was spreading. And at that time, Hong Kong has been slow in the rise for COVID, so it's slow the spread. What happened that you know that now when the Omicron come in early this year, this was a very different virus. So much so that you can see the red dots here are all those changed in the spike antigens, and it's changed as particularly rapid in Omicron. So much so it turned our immunity down. We cannot fight it. And this was by Professor Gabriel, and you can see that most of them, Hong Kong, were poor because of the immigrants. And just to let remark that the deaths were at the start very much alarming, and yet when the deaths coming down, the Omicron come in. What happened now is that we are also at a lot of Chinese medicine studies, and you can see that this is from the WHO. And initially there was a lot still now going on. These are registered studies, and we usually talk about Chinese medicine in combating COVID. We really have to talk on all these. So give me about 3 hours. How about that? All right. And simply said that we are having so many things to cover, and I won't cover today. What happened is that when I started this lecture, I was so not thrilled, but agitated. So today my heart still palpitates, but you can relax. All right, this is the whole idea. These are the two main names that started the COVID comeback in Chinese medicine in China. And you know that comeback in China, in the whole world, the whole world has noted that the pneumonia were not necessarily there until one fine moment in a patient, they suddenly had a storm, and so much so that it becomes the severe diseases. And the severe disease, when severe, would cause somebody to go into ICU. This is a very good slide. I think what happened is that it shows the inflammation, and it comes into hyperinflammation. That is a different game, right? So not virus, but the virus change in the body change, and the hyperinflammation, and the whole thing set into the worst stage. And you can see downstairs that the antiviral drugs and immunosuppression and reduced infection are the mainstay in Western medicine. What happened in Chinese medicine is called down there, and we call it Wei Qi Ying. Okay, and what Chinese medicine is different is that they look at the whole body in the environment. The environment is called the outer big environment, and therefore they have two words called the Wang Yi Sheng Hong, or Yi Sheng Hong, meaning whatever infection is infection of the climate itself. Right? Of course, it carry viruses and bacteria. And you heard about the Feng Huan Xu Shap Chou Fo. And the diagram of climate is much more complicated, what I'm not going to deep today. And so in the early days, it started with what we call the Huan Shap One. But yet in the early days there, you can see that the big masters in Chinese medicine give a lot of different names, different, I would say, connotations. The way that the body reacts, so it's kind of confusing. And in fact, you can see that a lot of medicine, a lot of different formulae, the Chinese medicine formulae come in this game. Finally, whatever, we have a few winners, 清係肺排毒湯、樂同小林, and the other you heard about the 蓮花 and the 茯香 and the 金花. Then maybe I diverse a bit on what actually we are doing in Chinese medicine. Chinese medicine is what we call heat diseases, right? Heat is inflammation, whatever. And it starts with in the Han Dynasty, the early dynasty, when it's called Sheng Huan. That's about 2,000 years ago. And then and come into later in Qingdan, this is not too long ago, the Wen Bang Hao. And the two things are most important thing. You can see that they are called different Wei He in Yue and the Biu Lei. They are different, a lot of, in fact, it also may confuse even Chinese practitioners. But simply is a Biu outside, in, and out. And you can see here it's a more complicated slide, but make it simple. That what happened is that the Zhang Hanren here, that the differentiate the yang, is the warm part, and the yin, the colder part. And it's different, differentiate in the different syndromes depending on how the body reacts. But what happened is that although the two changes and concepts seems to be different, in fact, you can see this is the later one band, the endemic febrile disease treatise is looking and expanded this part into more greater depth. So whatever it means, there are the things to but we are now using most of the later of what we call Wei Hei. And this is the go with when it come into the whole body, it reacts the whole body different symptoms. And what the Chinese medicine to localize it, called the Hong Yi, whether it's the characteristic of the disease or the Hui and how whether this deplete or replete or whether this is in and out. And so it seems that a way to look at the whole pathophysiology. So finally, you can see that they determine it as usually the humid disorder. Humid is I would usually make it a simple term for people who can't stand the humid changes, right? So they react differently and poorly. And when they come in, there is a lot of complications. And with the virus, that's what happens. So the Western medicine also do that. The difference here is that you can see while Western medicine use one medicine to treat everybody, or at least have a soft and a soft. But Chinese medicine tend to use one medicine for one person, right? So there is a kind of advantage to use one formula for one person. And it started early when people in our community, you can see this is our journal, and down there you can see the Professor Lin of Chinese medicine at Maryland here and on Kennedy there, right? And there was already started to hear the use of Chinese medicine is much more expanded now with Zhang Guoklai. We probably heard about that, the Chinese medicine expert in China. And he worked out all those ingredients and what happened represented the Dai Wang, the Wang Sam, and Chau and Ma Wang and Lin Qiu. And all those things happen, but whatever the complication is, WHO finally reviewed the whole thing and a lot of review a lot of trials and also from the clinical and also case reports and also the drug and the whole concept whatever. And they find that the GCM help alleviate symptoms, shorten the time of positive to negative conversion, and reduce worsening rate of non-dysphagia. That is to say, it doesn't worsen, that it comes to stage 3. And it reduced the mortality and reduced the duration of ICU care. And so finally, with Hong Kong, the changes in Western medicine, the Hong Kong people asked Dong Xiulam, and this is Dong Xiulam, this is Zhang Dakzhong, who come down to the Hong Kong to help the COVID, right? Dong Xiulam and Zhang Dakzhong and his team. Of course, this is not only their work. Hong Kong U also worked on this, and this was a paper who tried to review all the methods. It's very complicated, but simply they worked on various aspects to look at it. And it again to look at all more important the usual forms, 清肺排毒湯, which shorten stay, and with the 肺炎一度 of 廣東 to use to a negative change in negative time, and the lympha, how it affect the CT changes. And simply is useful. So what happened is in the Zhang Lai is they even map the whole other a lot other medicine formulas used and all those things that find it very complicated to list to make sure that this make a lot of things that are useful for strengthening the conviction that the TCM is useful for mild stage, moderate stage, or severe or critical stages. There are some, of course, early stages that work on what is acting, acting on viral applications, viral DNA, whatever you name, and they try to find and this and that and how they're useful. So it prevents all those things and it's just to make sure it's more simple for you to understand. This is the simple slide by Chau. I try to make it even simpler. Is you can see that up there the Wong, and Chau start with it out before the virus come into the cell, and then again the Wong. What we probably know that we are so used to, and the Wong Sam, all fight in the cell itself. And so simply, again, Chinese medicine give a different perspective. The perspective is so different that there were, at one time, when they started, people in Chinese medicine work with a formula that depends not what you're looking at, but the mathematics of Chinese calendar. You got my point? It's the time itself. You know what to check, what to treat. So does not. But as I said, this is climbing. So really look at the whole entry from top to down. This is a Western journal, and you can see that the West Chinese medicine also look at this, but not as in such detail. To start with is called the Wei in the outer side of the body at the cells, and it now come into the inner side when they call it Hei, right? And these are the Wei, Hei, the tongs, the Anqiu you everybody know, and Song Gok Yang you probably know, and then afterwards, and become in more deeper called the Yin Fan and the Yin Fan. So again, you probably can see that this is the virus which is encapsulated by the lipid of the cell, the endoplasmic reticulum, and it enters the cell with a lot of, and the blue parts are the what you need to read, like the what it act on the more cholesterol and lipids to double membrane the virus vesicle, or the alveolar desquamation is due to this adhesion and other things, and they come into the innate immunity. So what happened is that the virus comes in the way, the Hay stage, and it affects the white cells. The white cells, and you can use what is common as pneumonia Chinese medicine formula. This is a very common Chinese medicine for pneumonia, whatever pneumonia, like okay? And it cleared the Qing Fei Pai Tong is also in this regard. And when it go more deeper, then it's a different game because it affects the brain. The blood vessels begin to leak, and because of the albumin also leak out, and the changes in fun, sitgong, and the changes all in a systemic way. And this, what happened is that there is a lot of things that happen in the platelets or whatever, the tight junction or whatever, and it enter into the brain. This is, of course, the stage which is severe and in the ICU. And you can see how the blood vessels actually leak. And so it's both leaking and clotting problems in that stage. Now, when you go further, it would cause this coagulation. There are also papers in the Western medicine which cause the red blood cells is stimulated. They try to stop the immunity by the red cells, and the red cells. This is how to see the craziness. And simply, this is a simple, simplified slide so that you can see that, to start with, this is the lymphoma. Whether you're asking, this is actually acting on the first two stages. The second two stages, this is not good enough. So just people who ask me, you're coming in the first stage, look at it, you can use it. Now, this is, of course, in the orthodox thinking. But in fact, you look at it, the whole thing is that how the Wai and into the Tai King, which you mentioned, and in fact, a lot of simply steps in or stages in the development of the disease. Now, what we have, the number of drugs here in the combinations are, as I said, the Qingfei was the first used Chinese formula by Dong Xiulam in the China, and this was so successful. It started with what we could use also in common drugs, and in fact started much earlier in the days of SARS. It was meant for SARS and the usual flus. Now, the Qingfei Patong was a combination that was used, and you can see again here, this is the combination of the traditional orthodox combinations, and they combine these combinations into one Qingfei Patong, and you can see again this Ma Hang Se Gam Tong for pneumonia. All right. Now, of course, all those things are just for your information history. And if you come to a patient, of course, you treat it as an expert. You don't use just the medicine. The expert would use a lot more differently, depending on stage, depending on what is affecting and what it has affected. So you look at the whole thing, and it's kind of clear that your own poor conception. You say the Chinese medicine just treat symptoms, because they have thinking inside of it. So what I like to point to you that we start with Binjing, the analytical differentiator syndrome, and the most of course important is the tongue diagnosis and the pulse diagnosis. And these are the points that people have known how Western medicine are looking at in terms of how once you have these indicators, go for watch it. Now, of course, tongue pulse diagnosis is difficult for you maybe, right? But I like to share with you a bit and see if you can appreciate what happened is that if you have these are the stages which painted on, and to start with the heat stage is you can see cold, and the cold then changes and whatever. But one thing, first of all, I like to share or stress is that the bowel motions is particularly important to prevent late stages of development. Right? So ask always the bowel motions. But talking about tongue and pulse, you might not understand the pulse, but the tongue may be useful if you follow a bit. Now, first of all, this is the tongue, early tongue, right? The early tongue, and you can note that when it come into more humid changes, whatever the body is not reacting well, then it become a bit different, right? And you can hopefully appreciate how it's different. The worst tongue, and the tongue become purplish. Purplish that means coagulative issues, right? And then after this, then you can look at whether how furry or how strongly spiky coated, and you can see when this is worse, that is even like this. Okay, so this is a child, two younger children, and you can see that the tongue is not normal if you have seen enough, right? But to you, you might see it. So, but you look at this. A tongue like this is certainly not normal. If talking about even the raw part of it, this younger child has a raw tongue, raw and a bit purplish too. The tongue, if you look in a lot of children, they don't get raw. And so this is what we call 陰虛肺炎. Cut all this. You start with 驅寒, 驅邪, clear the infection, whether it is in the upper, middle, or lower. All right? And there are a lot of medicine used and a way of diagnosis. The next thing you need to do is to 扶正, to make sure the body can react strongly, well. And of course, it's called 氣, Yang and Yang, right? The Qi and the Yin and the Yang. And again, there are medicine for that. The last thing is that you have to treat the body depending on how it progresses and what. But one thing I like to use is this, I would say newly developed by myself, of framing the body. We look at diseases, all right, but we have to look at the body as well. We look at diseases as is it local or general, okay? But we also have to look at the body by its body state and whatever elaborate changes, or we call the features difference. And the body state in Chinese medicine is mostly called the tendencies and the syndromal diagnosis. But once you spread on this is called injury. You might use an analogy. And this is an analogical point rather than real. Or it might be toxic or polluted if it is a general disease. But when the body state is ruined, it's more wrecked. And when this kind of the features are adhesive, whatever the range is a corrupt kind of. So the Chinese saying is called 傷毒殘亂. Right? What happens is that if you describe something less, then you tend to, well, not as good. That is to say, if your body is wrecked to start with, you got COVID, what happened? You can expect. But you just say COVID without talking where the body already is wrecked, you're losing something else. So start with that. So I don't use ABC, I call Gabyiping, just to make sure this is a paradigm you remember. They will come in later and come back. Now, this is a kind of simple case illustration. So whatever it meant, okay? Now, if you treat, they are called something called rebound phenomenon. The recent US president had it, and the wife too, they rebound. What happened to this is they had a lot of Chinese recently had a lot of ways to answer what happened. But I'll answer it differently. We treat the body to start with depend on the early soul meaning, just always what happened. And you treat the illness when it's become a傷and毒, whatever. When it's worse than when the patient has been wrecked and corrupt, you have to treat it too. Else they may rebound. Look at the US president, you know what I mean, right? The last two words, I don't want to speak it that loud, right? Otherwise be sued. Okay? And so you look at the 重症 again. These are the warning indicators in Western medicine. I don't read all those things. But tongue, looking at the rect state will help. And we've been looking again in the WHO review. You can see that the patients can be shortened in time from positive to negative and reduce the worsening of states. And the motor ability and the promotion of psycho recovery also helps. And most importantly, the studies reveal that there's a good safety profile with using TCM. There are a lot of studies also to say that the use of integrated Chinese and Western medicine is much better than simply Western medicine alone. Okay, you can understand what I'm saying because you are treating also the body itself, not only the illness. Now, it depends on how fast you can clear the infection, isn't it? Right? And there are a lot of studies now to say that even if you can find the virus even in the stools too. So we now come to what we call the long COVID, which is a very difficult defined, not well defined subject. And whatever, whether the patient may be poor, old, poor, pre-morbid, and more severe, whatever. Think about this, even those with poor support, right? The elderly, they probably can have more long COVID. But I'd like to go further to see. Now, the long COVID risk factors are now quite sure now. The more severe acute phases, to start with, the more likely they have long COVID, right? Then there is a lot of association with things of the sex, whatever. They are not so sure, right? They're talking about obesity, of course, not the rec state I mentioned. Nobody studied that. Interesting for me is that the pre-existence of asthma as a significant association with long COVID. That's very odd. Well, because we will come down. Now, long COVID is a combination of disorders, and it was demonstrated that in these states, immune inflammation aspects, they cause antibodies, and demonstrable that the antibody, the ACE, which is now the average, was reduced, antibody. And it's a dysregulated immune disorder. Organ injuries or whatever come in, and virus injuries. Simply say, go back to the ACE receptors. The virus go into two receptors, the ACE receptor and the TMPRSS2. ACE we know, but we start looking at the ACE, you can see that the ACE come in, the receptor loss and whatever, the plasma ACE changes, and the brain also have ACE receptors, and then whatever it comes in there over there, it also is all the brain, the hypertension, inflammation, things you can, whatever you like to count, and also the diabetes and other things, the changes in endocrine functions are all kind of also reach because they reach in ACE, they're related. Okay, about that. The long COVID, I think there are two things. One is the respiratory problem. One is the other problems. The respiratory problem, like there are research like in 3, 6, 9, 12 months, you can see that there's some improvement in the DCLCO and the FEV, right? And the walking distance in time get a bit, but not everybody. Now this is another study which shows that the DLCO, which actually meant for the diffusion capacity of carbon monoxide, right, is not okay long after colposcopy. Although the FEV get not so bad, right? The FEV is related to asthma. Remember I talked about asthma? Now the DCL is related to parenchyma, lung parenchyma. The lung parenchyma is more deranged. So I see long COVID myself, and I'm sorry to say that long COVID doesn't mean anything to me. For the long COVID patient come in, I treat them, they got well. So I don't have long COVID patients. But there are two things I said. If they have lung problems, they tend to stay. They tend to stay because it's real damage, right? But for the rest, it's reaction. So you treat it, they get well. So I think that it should be different, right? So the reactions, antibodies has been done, and antibody and whatever has been done, and they can see that lymphocytes, whatever, have a lot of changes, and they don't come back easily. Sorry. Right. Simply said, this is a small slide, but you can read it out, is that the immune dysfunction, dysregulation, autoimmunity, and the virus persistence all come in. And also the guts there, which is related to immunity and other things, also can come in. The gut microbiome. Viral toxicity, inflammation, thrombosis, and vasculitis, and autoimmune response cause this whole picture, and the thrombosis coming is a kind of long COVID, depends on how severe the stage to start. And also the chronic inflammation and the lung and the can come in, wrapping the virus, come in with the whatever come, and then you can see that then it affects the blood vessel and vascular disorders. Again, I'd like to point out again the two ACE2 and the TMPR S2 receptors also in the vascular. So interesting. Now, another thing is, of course, the reduction in global brain size, which we are more would be more keen at. There is certainly some brain problem, and it even can shrink the brain. So the part that shrink seems to be more significantly in those are related to the nose, the olfactory areas. And you know that there are a direct link between by neurons. Now come back what we are talking about this slide. So again, when this is having the disease, it's affected because of what we call the four factors. And these four factors can cause memory loss, hair loss, poor vision, and of course, down there, when it's wrecked and corrupt, of course, it can affect. So far, you can see that Western medicine can do a lot of things, but those down below, what can we do except Chinese medicine? So there are two things in there. So let's go into children. Children, you can see that this was a trend. And what happened in the USA, you can see that it's more or less the same percentage, but with the Omicron, it's kind of worse of the numbers. Notably, treating children with viral pneumonias is acid with use of Chinese medicine. Chinese medicine, this is where we use, okay, not bacterial, of course. And of course, whatever, but it's might be here, he'll be listening to, he know that he was stressing the MISC, the multi-systemic inflammatory syndrome. Remember we talked about inflammation with Chinese medicine? So we are there. That is characterized by those, especially that the younger, the more this comes in. When you talk about recovery, there are two things. One is called Qi, and the Qi we call Hui. You heard about all these, and of just the one thing mentioned is, although 人參五味子湯 is useful, 人參 is better not used in children because it is too or whatever, and use 太子參, okay. The other is Yam Hui. Yam Hui is I show you about how the tongue got raw and dry, and it hurts, not just being dry. Being dry because inflammation, and we use what we call, read it clearly, it's called Sa Sam Bak Dong Tong. The tong is in Chinese, should be right, and it can help the T1, T2 balances, so even eczema can be useful. So these are the ways that how it's been studied, how each of the herbs I mentioned, Tai Chi Sum, Bak Sut, Wang Kei, being useful, and Bak Dong, Bak Sao, Tin Dong, whatever. Now, after this, we're talking what we call means, but the concept is we have treatment. When you treat if whether the patient is high on it, whether it's repeat, cold, hot. And of course, you use those things, but mind you, we thought bijap is very useful, but bijap is Chau. And I always say that if you know nutrition, you don't know Western medicine, but you don't know Chinese medicine, you don't know on the so up to you, all right? I don't use it when this is inflammation, even eczema too. And when it's inflammation, first off. And then you talk about Gai Hao, of course, the Bok Bang, for no way, okay? And of course, the smoking. And they are also talk about the brain fog. The brain fog is a very difficult thing. We have had a lecture by the Hong Yu, professor in neurology, and this is given a lot of things, but it's not really totally clear what it meant. But simply, it relates to sleep deprivation, similar to people with depression, anxiety, and even after menopause. What it means is that it is a kind of common reaction, but worse with flu, even worse with COVID. So I think what happened is that, what happened is that they have not done this in the study. They have not done this previous body state unchecked. So you check whether they have done a lot of computer games or sleep inadequacy, it might turn into a different perspective. This is why I was always enthused about research. They know more, they get more. Junk food, okay? Right? So they have been looking at the diet quality and even how bad the patient was and supported, and they find some relevance. And one study early was that if you take good diet, Mediterranean diet, Western stuff, right, it's get less COVID, less severe COVID, right? Believe it or not, okay, but something like that. And Chinese medicine in Chinese U also did a study. He lent me the slide, Dr. Professor Lin, but simply said you can see the 六君子湯合沙參麥冬湯係 really allowed. And again, you can expect that it get better, all the symptoms get better and whatever, and the other things. So that's trying to show you whatever I have. Now, if you use, therefore, Chinese and Western medicine alone, then you can give a good outcome by strategy. What about G6PD? I got a patient here who was consulted me by remotely, and this was from a good professor in Chinese medicine. He said, I got the child, some 10-year-old, is this what cough and voice lost, and is that all? But 5 fever, yeah, that's right. I said, okay, ask me. So I said, okay, let me try. You know there's G6PD, I know. Let me try, okay. But I ask her how about bowel motions, okay. And then I give her medicine here, and seems okay to recover. In fact, G6PD is not out of a treatment, only how you know how much about it. And really, how common is long COVID is a difficult question. But I think the consequences of the COVID is more should be looked at. So the more severe the disease, the more worse the outcome. It like an injury, okay? It's like the injury. It changed the things, toxicity, inflammation, vasculitis, autoimmune, and the gut. And it comes into the time, the memory loss, and the immunity changes, and the virus may persist with relevance, and the inflammation comes in, and even affect the nose and into the blood. But when you can see that the Chinese medicine can help all those things, and affect also help the immunity there. And I come to the even what here about the social dilemma. If you have a lot of children, you can see that the body burden, if it's not wrecked, not corrupt, and also the autonomic dysfunction is better, then all those burden would be decreased. Not to count the all those things, but you can fight it easier. Okay, that's what I'm trying to say. So here we have also the second line, which is form. Research of a treat. Then we have done, this is me, myself, and this is Leung you heard, you probably can see. We use the 玉屏風散 and the 桑菊飲, you remember the 桑菊飲 with the 連翹散. And here, that we use it and then come with whatever, it helps, right? You know, and these are the things that we say why it helps, okay? Now, my proposal, and this is my slogan, is to use 防擋治, right? This is a good way to think about it. 防 simple, prevention. Treat 治 easy. But 擋 is when you have people who have been contacted, those nurses who have been running around in HA. I think this is the way. Of course, at that time, people used Linfa Ting1 because it's only available. I have other things milder, and this works, okay? And form also can be done that way. So what happens is that when you have a contact, you don't rather than just form, okay? And then you treat by the blocking the spikes in. The Linfa has been proven in a way by a lot of studies to say this can help treatment also and in prevention, right? Mind you, if you don't know the constitution and the ideology, I think this is not just use it. And there's a good review by one of our doctors. She's now getting into Singapore, become the director of Chinese medicine there. And she used this kind of laid out and a suggestion. But simply, this is the way to use it. The way to use it. And if you are having better, you can consider it. If you have a GI not too good, and if you are older, don't use it. Don't up, low it. You are older, right? Not this. Okay. Low is too old, right? Right. Okay. But the thing is that they have side effects, inclusive, or whatever. The most important thing for you know that it can affect the liver. All right. And the compound is less strong, but of course, it also has some other things like hypertension and other things. All these just point out that you need to be assessed before you use it. And more importantly, is the children and pregnant women and those who are kind of immune. Try to be careful. These are the things that we've been using, trying to do. And it's a good suggestion to use something that is easy for prevention and easy to be used for total care. This is the last thing to say, Hong from Dongji. The whole Chinese medicine and Western medicine, how much this is used and where to use it. And this is the WHO as demonstration of when to use it and other things which I'm not going to talk. So simply, this is my presentation. I hope I don't bother you with a lot of details, but trying to give you some skimming of the things that we consider in the use of medical strategy in prevention, blocking, and treating COVID. Thank you.
Thank you, Edwin. I'm sure COVID changed our life, more so with children, and they have relatively less reserve. And I've seen more than 50 genuine COVID cases, and I've sent about 3 to 4 to a K hospital. I'm sure all colleagues, we are all brothers and sisters, and we face the same. From Dongji is very good insight for me. All right, I've seen parents, whole family get infected after the May it's infected. A young baby was 10 days old. So just a little question, in fact, for Professor Yu in the early stage, how can we parents that can use Chinese medicine in preventing? They know that all our children are symptomatic. We just give Panadol and Proven. How can they do, or how can they consult someone who can use Chinese medicine to protect their children in the fall?
Right, thank you. I think it doesn't bother me to tell you that in Western medicine, they think they have a lot of ways to do form in boosting up the body and the surface epithelium, right? I think there are a lot of ways. But I believe myself, that Chinese medicine, if you compare the two things, is two different. One is there and the other is there, right? So whatever this is my belief, right? So I think Chinese medicine certainly has a lot of help. We know that in Hong Kong too, the first thing, of course, whatever 我哋話嘛正氣在，或者最緊要正氣在嘛嚇，除非我講咁啊，所以正氣好緊要啊，即係一定要 say you treat the body first. That's boosting up the body. I was just asking Miriam, how come that she was so healthy? Must be doing a lot of exercise. She said, no, I don't need. Oh, I beg your pardon. So good. So the environment, but love, isn't it? Right? Love, right? So first of all, it's like this. I can talk about love, the rabbit experiment you have ever heard about. And so this is the first thing. The other thing is that of course, you can really treat the body itself by exercise and other things, Western medicine and vitamin C. But once the Chinese medicine, there's certainly much more to do. It's a whole holistic game by immunity, the service, and whatever, like eczema, you can do it, and all the, this is the body itself. Then once you contact it, you're afraid of contact it, I should say. This is what we call probably the early stage. I try to use a very mild, but good enough for the climate, sorry to say. So what I'm doing now was different from the day when I was using SARS. Okay, so that's the formula. The formula for me is good enough because it's given by my teacher expert too. So there are different games, but simply I think there are some better resources where people using whether use Linfa when it was no resources. I would say now there are so many Chinese medicine resources. There are a lot of things to treat.
I'm sure lots of colleagues may have questions. In the best interest of time, we cannot entertain online questions. Any questions from the floor?
I'm 70 years old. Right? If I actually have an RAT positive tomorrow, can you write down a little prescription for me? Right? Because it's very complicated. I can't understand it. So give me a prescription. You want to look at my tongue?
Yes, sure. Now, this is the kind of simplified diagram. The Sangmat sign is very easy. It's only a few medicine. But I myself, if I know you, I would use more, I would say, definite stuffs. Okay? So, welcome coming to me. And if you like to show your tongue here too. Sorry. That's that. Certainly. Right, certainly.
I have a question. Since I'm a frontline pediatrician, so can you? I know that there's a lot of benefits in traditional Chinese medicine in treating COVID, and also there's some essential steps that the Western medicine must be involved. So can you give us a simple algorithm, say just like first encounter patient when or the child or any adult start off with the say. Chinese medicine treatment and say suppose if the disease got progressive, what is the time that the Western medicine should be called in or at any stage that say at the most severe stage, how did Chinese medicine come in? The patient is ICU. Can you give a simple algorithm going through the steps?
Yes, certainly. This was the time when we talked about. There was in April when we hosted a symposium. What it was talk about the Zhang Dakzhong and the HA Tony what Tony Go, that's right. And from also from Professor Fan, and we talk about how. But we talk about how it was okay. But there was one lecture which was given by the people who are now working in the Zhongyi Sai combination in the community, and they find that also a remark from Zhang Zhong is that the interaction between Chinese Western and Chinese and Western medicine doctors are very smooth. What I'm trying to say is that you have to interact rather than just an algorithm. Simply, an algorithm can be understood. Once you can see Chinese medicine can help everywhere, right? So as I said, you send a patient to me, you don't come back because everything I can treat. You don't refer back, right? So this is Chinese medicine. No, this is not the way. The algorithm is to say that at some point there are indicators. I showed you the tongue. The tongue is a good indicator. The bowel motion is an indicator. Once you get in the brain, I think you must use Chinese medicine rather than leave it alone. Right? I think that's the main thing. Then on the lung, then Chinese medicine and Western medicine, both of them think that they have something strong. Okay, so it depends on how you react. But as I again said, when you come to the autoimmunity changes and the dysfunctional immune dysfunctions, once you see a lot of markers, I think Chinese medicine should be there. That's in the acute stage. For the post-acute, post-COVID stage, I think I don't know what you can do Western medicine, right? So I think I've just listed a lot of things that which Chinese medicine can help, right? That's it.
Ultimate call for help. You mean that?
No. In the acute stage, it should be a smooth interaction between the two camps. Okay, acute stage.
But in the practical terms,
Sorry, I can't hear you. That's of course a severe case. The mild cases, as I said, whatever you treat, you can go through. So that's another game.
Definitely, that recalls me of some of the patients who has COVID and going to drowsiness and convulsion. So how at this stage that we determine whether it has gone into the brain or the hyperimmune state caused febrile convulsion, and the patient will recover like simple febrile convulsion. How do we differentiate from the using?
In fact, when I was preparing this lecture, I was trying to do a lot of slides on that, but trying to find the rest, too many slides already. So I cut all those things. I think the brain is most interesting. There are a number of ways that go into the brain. A number of ways. Simply ACU you mentioned, right? It goes in the blood, the coagulation is mentioned. The virus, it can directly go in, also by the nose as well. So all those things for sort of not mentioning the changes on the body itself, the body, the immunity, the bowel motion, the bowel itself. The bowel has a one direct vagal response into the hypoglycemia, also brain. So the brain is so interesting. There are so many things that can move it. Our doctors' role is to differentiate when and what. Now, of course, when the acute stage, there are a lot, or maybe a lot, all these are coming in together, so it's good together. But there are stages when they don't come in together. If you know it well, then you can differentiate. I'm sure you can. And not by the tongue, myself, the way that the way to present, surely I think it can. If you want to talk in another hour, I can talk.
Any further questions?
Right.
Not,
thank you.
I'm sure that we all appreciate Professor Yu has given us all this enlightening challenge of integrative medicine. This most difficult part that I find. As pediatricians, we all treat children. And children, most of them, they are mild, but once they go to complication, we are very worried. Once they convulse, once they are very drowsy, and they have repeated vomiting. I have seen so many, and we need to ship them to AK hospital to our colleagues there. But if we can find someone, some way, or someone who can really predict and an algorithm of halting the progression of the hyperimmune states, then hopefully we can cut down the complications. So
maybe I stop here. Remember, not algorithm, but 2 points. The tongue, furry tongue, raw tongue, and very spiky tongues, right? The tongues. The bowel motion doesn't change, and bowel associated with mental change. And there are 2 points which you really have to think seriously of Chinese medicine.
Thank you. All good things need to go in the end, but I think the thoughts and the stimulations that enlighten us to meet our next challenge. Suffice to say that COVID is important, but I'm sure you're hungry now that we should all join us to thank Professor Yu's enlightening lecture. All right. Thank you those on the web, and I declare the scientific talk is to an end. Thank you, Professor Yu. Welcome all the new guests. I hope you see your own name tag on the table. Now is the lecture is over. It's friendship time, and we can have drinks, and we can exchange all our experience with managing children. Okay, thank you.